On this episode of the ACSELL, we're speaking with Vicky van der Auwera and Ingrid Adriaensen from LiCalab. We cover what a living lab is, the importance and benefits of living labs for SMEs, end users, and other stakeholders. And we learn more about LiCalab and their involvement in the ACSELL project. Here's the episode. So thank you both so much for your time. We are very much looking forward to this episode and speaking with you about living labs, about the living lab approach as such, and of course your extensive experience and knowledge that you have been able to collect over the years and sharing that with our listeners. But before that, I think it would be great if you could introduce yourselves.
So I am Ingrid Adriaensen. I'm the business manager at LiCalab. So my main task is to connect with external partners and businesses, and to communicate with our living lab, with our operational team, what your expectations are.
So I am Vicky van der Auwera. I am the operations manager of LiCalab, and my task is to plan in all activities for the operational team for all projects with companies, European projects, and so on, and also manage some European projects myself.
Might be good to start with a definitive question about, what are living labs, because I think if you ask 32 different people, you're going to get 32 different answers to what a living lab is or what the concept is. So I think it would be nice to get from, your definition and what are living labs or a living lab approach.
Yeah, indeed. There are different interpretations of the term living lab, but living labs can play a role in different sectors. And when we look at LiCalab, for instance, which is short for Living and Care Lab, this is a living lab for care and welfare. But on the other hand, you also have living labs that focus on energy, mobility, social innovation, agriculture, and so on. So in general, living labs are defined as open innovation ecosystems. And in these open innovation ecosystems, the co-creation with the user is really central. This means that living labs connect with citizens, they connect with research organizations, with companies, with cities, with regions, in order to develop new services or prototypes, or to test innovative solutions with end users. Living labs can be organizations that support open innovation, but it can also be real living or working environments where users test new solutions. They can be linked to universities, they can be linked to knowledge institutes, they can be linked to local authorities. And some living labs are time bound, so which means that they stop after the execution of a specific project. Others have a more permanent structure, like we at LiCalab also have.
That sounds like a lot of work, not just thought, but real work. So in keeping that in operation, to organize all the involvement of all those users. So why would you do that? So what are the key benefits of setting up a living lab?
Well, when we started back in 2012, the care sector really was clearly in the need of innovation due to the increasing demand of care, and the quality and affordability of care was then and still is now under pressure. And with an aging population, there is an increase in chronic diseases and changed expectations from patients and staff shortages. So in 2030, almost also a quarter of Europeans will be older than 65. So that's why we felt the challenge to offer people a new way of care, and innovation can help, of course, like technology or new processes, for example, can support also people in living more independently. But companies are often quite far from the market, and the care sector is a very complex ecosystem with very specific regulations and reimbursement procedures. So only a limited number of innovations are really successful. And a living lab ensures an improved product market fit. So, in addition to user research, We also enable to match new developments to the demand and the needs of real users. And users often evaluate user friendliness, applicability in their daily working and living environment. And in this way, concrete challenges and possibilities become more visible. Life tests, they provide insight into what goes right and wrong, and above all, why it goes wrong. Based on these experiences, developers can adjust their concept. So living labs are therefore also successful policy instruments in innovation supports to SMEs because they can help developers and SMEs to explore, to co-create, to test, and to validate with end users in real-life environments. And through the user insights the companies gain in collaborating with living labs, the success rate of market introduction will rise.
I think it perfectly illustrates how complex of a topic this is, actually, specifically also for the care sector. As you were saying, I think it's just a very complex ecosystem as such, and just this whole thought of ecosystems, value creation in ecosystems and open innovation as such is just a new topic, a new mentality, and it needs a variety of different actors to engage with each other and to come together, and that's the thing. I mean, I think that, I mean, how do you? I mean, do you, as a living lab, do you engage with the different stakeholders? I mean, how do you engage them, or do they come to you, or how can we maybe imagine a process like that, where you bring the users together with the SME or whatever, might be useful to get a better idea about that.
So as Vicky said, LiCalab exists now for 8 years, since 2012. And it is our goal to embed the Living Lab sustainably in this ecosystem of research and innovation and companies. And we strongly commit to provide services to these SMEs and companies, and have international cooperation, also with other living labs. As for LiCalab, our focus is on care technology, and also on new collaborative models between care providers and between companies and care providers. So yeah, we take on a facilitating role between these end users and the companies and the cities and so on. In fact, and when we look back, LiCalab grew out of a regional innovation project. And it started really as a non-profit organization with, in the board, there was a local government, which was the city of Turnhout. There was a University of Applied Sciences, Thomas More. There was a welfare organization. There was a Chamber of Commerce. So this whole ecosystem was already well represented. And then thanks to the financial report of the Flemish government, we could grow our team until 5 persons between 2013 and 2016 and gain really extensive experience in innovation projects. We put a lot of effort also in building a large user panel of citizens and care professionals. So meanwhile, when we look at our panel, we have more than 1,000 users and over 600 care professionals that have committed to participate in our projects on a regular basis. Now we are a team of 7. We already said I am the business manager, Vicky is the operations manager. Besides that, we also have 2 panel managers who are really in direct connection with the panel, with the users and with the care organizations. We have 2 project managers who handle the projects, and we also have a PhD researcher. Now we are part of the University of Applied Sciences, Thomas More, and we offer tailor-made services for small and large companies, for healthcare organizations, for governance, and we are partners in European projects. When we look at our services, these include exploration of the context, for instance, by desk research, surveys, interviews with experts. We do co-creation, we do testing in real life or working environments, and we do business model advice as well. To make it a bit more concrete, in 2019, we collaborated with almost 1,000 citizens and care actors in about 35 projects. And maybe Vicky can tell a little bit more also on how we work.
Mhm. Of course, yes. What we find also very important is that we can work in a spirit of trust with our panel members, that they are well known to us, and also with the other stakeholders. But also this applies to also a scientific approach that we use in working together with them. For instance, we always take a look at validated tools, procedures, and methodologies to use in our activities, but also evidence-based criteria for a group composition, for instance. And also, all the legal requirements must be fulfilled, like GDPR, informed consent, medical ethical approval, NDAs with companies, and so on. So we also conduct our own research, for instance, on some local cultural and societal differences amongst international living labs, for instance, and international projects, so that we can anticipate on setting up the right scenario and the right protocol for a test or for a co-creation session. And we think a learning network is also of high importance. We are an active member of the European Network of Living Labs, where also good practices are shared and where we collaborate in international projects with other living labs and where we can build up partnerships with innovation agencies, with local authorities, with commercial parties, and also with investment funds.
May I jump in here real quick, Vicky? You mentioned, or both of you mentioned the large panel you have. So that's pretty impressive, I guess. And it sounds easy and nice, but maybe we could talk a little bit about the journey to get there. So how hard is it to reach citizens, and how hard is it to keep them in the loop? So to keep them motivated. So what are the incentives? What can you provide? So involving citizens into the panel, but also keeping them involved. I guess that's a pretty tough one, isn't it?
Yes, when setting up our panel, it took quite some time, of course, and we worked very close together with local authorities. And we started, of course, in a collaboration with the city of Turnhout, what Ingrid already explained. And we got some support there from the mayor and from other advisors in the city to connect with the elderly people, because we started up with a panel of elderly people specifically. And so I think after a year or two, 2 or 3, thanks to the support of these kind of people, we could end up with a panel of 500 to 600 panel members, elderly people living in the city or in the environment of the city. But also, of course, starting up with projects, you recruit again new panels, you recruit care experts that want to work together with you in sessions and in live tests. So the panel grows and grows, also thanks to all the projects and all the cases with SMEs that we have during the years. So we have a kind of let's say a basic panel that we set up in the beginning with elderly people in the environment of the city, but also thanks to many projects, our panel could grow and grow and grow and make it very specific to the case of the SME. So we work together also with younger people, with informal carers, with children even. So we really adapt then the panels to the needs of the innovation itself.
Oh, great. So you work as a trust broker somehow. You were talking about the spirit of trust, and I think that's an important one. And I can imagine that you, as an organization, also, yeah, affiliated with the university and so on and so forth, that you work kind of a trust broker. Out of your broad experience and rich experience, what are the groups that are hardest to reach? So where are uh, so where could you see this is really, those are the toughest one to reach? Is it the end users or the SMEs, or what kind of end users? Can you say something about that? Maybe are there any patterns we can learn from? Maybe.
Yeah, what I find difficult in the projects that we did is to reach out to vulnerable people. Vulnerable people will not immediately really react on a call to be engaged in a project. So you really have to go via ambassadors, via more trusted persons to them, because of course we build trust between us and the end users, but still for very specific groups we also need a link in between us and them. And that type of ambassadors often come from organizations that really specifically support these groups of end users. It could also be with specific patient organizations, for instance. So when it is difficult to reach out to them, we also work with these intermediary persons and organizations to reach out to them, because they're also a very trusted source to these types of people.
Yeah, absolutely. Yeah, I mean, this is we've got the same experiences. Though you need, for instance, welfare organizations in some areas, the church or hospitals. What I mean, some trusted also people, not just organizations, but also sometimes it's people, as you say, ambassadors that open doors and make sure that you are able to reach the right person and
Yes,
people.
that's
Yeah,
true. And those ambassadors can also be the first lead users to give the example to others, and others can join later on. So that's often the way it goes with the groups that are difficult to reach out to.
great. Yeah, thanks.
Yeah, 'cause, I mean, the experience that we have, sorry, that the recruitment for these users to participate is just extremely difficult, and I'm just very impressed that you guys have such a large panel, and also for the care organizations or other providers that you work with, because it seems like the base, only with that you can really actually function as a living lab and provide that type of a service. But I mean, just really quick, I mean, we were also, the beneficiary, let's say, maybe of working with you guys, having the experience of working with you guys, because you're doing a transregional experiment and asked for a German test site, and from experience, I can say that you really did a wonderful job from LiCalab, kind of providing advice on how to conduct these types of workshops and what to look for and everything. So it's really well established, of course. In the work that you guys do, you can tell that you just have lots of experience, and share that also, because this is something that we were also able to learn on how to work like a living lab, let's say, or to work, conduct these types of co-creation workshops and what to look for and how to set it up. So it was perfect support that you also provide in that. But what I really liked when you were talking a bit ago is the fact that living labs can really be a policy instrument, or are a policy instrument to support SMEs in innovation processes. I thought that was an interesting thought, or an interesting way of maybe perceiving it, that I hadn't perceived it as yet, because as you were describing how you were set up, it was really in a way coming from the top, let's say, maybe it's more of a policy initiative, and just the start of them being a policy instrument, I thought is really important.
No, but I think you're right. And also coming back to what Daniel said earlier about this trust. And we at LiCalab, being we are a neutral partner. And this also means that when we have contacts with SMEs, and we go to a care organization, for instance, it will be easier to have access to this care organization and to these end users. We have this role of trust in between, and we can offer better access to the care organizations for SMEs, because when there is a commercial partner coming in, it's much more difficult, of course.
Yeah, it really does seem like that needs to be a neutral organization, a neutral actor, orchestrating these different activities, or bringing the different people together. And so, yeah. And also, as far as funding is concerned, I know I'm maybe going off the topic here, but really, as far as funding is concerned, I mean, there also needs to be, I think, a different, I don't know, setup, but you need to have the support from political actors in a way, to sustain part of the operations and activities. So, the funding, partial public funding, but also probably private is probably an important part of a living lab business model.
Yeah. Indeed, we have a combined business model, meaning that partly we are supported by the University of Applied Sciences, of course. We work in European funded projects, but we also work for private companies. So we have income from these private companies as well. So it's a mixed model of income and revenue.
Yeah. Yeah, it's always a big topic, of course. How do you fund and finance those types of activities? Because, yeah, I mean,
This
it's like,
money thing.
I
Oh, I
know,
hate it. Yeah.
I know. I mean, I suppose it goes into this question of how does LiCalab work as a living lab? Because where does this initiative come from? How do you approach the different actors that need to come together for developing a product, or a service? Who initiates the different projects that you do? I mean, I'm sure, as you were saying, there are probably different frames and different projects, but still, I mean, it's who initiates, because I'm sure sometimes you have one interesting challenge or problem, and it's like, okay, do we have the resources to be able to bring something together, to find a solution to that problem?
Well, we started up, of course, like Ingrid said, with the support also from the Flemish government. And the program of the Flemish government really was set up to get to know the Living Lab approach to SMEs, so that SMEs could know, what does a Living Lab stand for? How do they work? Do I have benefit with it? Does my product match the market better? So they could experience the way we work. So that was the issue of that program then, where we got the funding. And we also did several projects together with companies, and also we were new then at that time, so we just started up, so we also had to experience and how to collaborate with companies. But since later on we created some support programs ourselves, also thanks to EU funded money, we could give companies more and more support, and we are also more and more experienced in what a company really needs when they are looking at new development for technology or a new process to use in a specific care organization, because we are also very linked to the complete health ecosystem. So we are in close contact also with those care organizations and experts. And that's also why we set up the programs very specifically for, let's say, just starting ideas for an innovation, a concept, and what services they could benefit from. But then later on, when they start developing how to run a live test and so on, the procedures, also the contacts with the right end users, the right care experts, because they often don't know those health ecosystems that well in all those different countries. So living labs are really well set up to deliver them that kind of advice and support for them to get to know all regulations and health ecosystem in those regions where they want to enter the market. So for us, it was really also very interesting to learn from those experience in those specific programs as a living lab as well, and how to link with those developers and with those innovators, and which type of support best matches what they also need. And of course, right from the beginning of the development chain, we include those end users, and we link always the next step in the development to the need and to the use of this type of innovation in daily life of these end users. So
No, it sounds like an invaluable experience that you have been able to collect over the years. But so we understand it right, that you provide services or consultation services from ideation up to market entry.
Yes, yeah. From the very start, indeed, from ideation, also prototypes from very low technical TRL levels, technology readiness levels, until products that are ready to go on the market. And there comes also in the international aspect, because when you have a product that has been well developed already and which is ready for the market, or maybe already even in the form of a minimum viable product on the market, for instance, in Belgium, a lot of SMEs seek upscale to international markets. And then we also link back to international living labs to see how the ecosystem is over there, and if this specific innovation can also be used in another market. And in this way, we can easily collaborate with other living labs and really add a value for the SME as well.
Which brings us to regional collaboration and the ACSELL project, more or less. So maybe at the end, we could tackle a little bit your role in the project. So what is your role in the project, and why did you join, or what is in there for you as an organization, and maybe also as a person?
LiCalab is an advisory partner in ACSELL, so that means that we do not have a specific policy instrument to address or an action plan to be made up. So in this role, we can be a member of the transfer panel, we can advise, and we can provide coaching to the other partners based on our own experience. We also do assist the Flemish partner Flyo in setting up the regional stakeholder group in Flanders, and also to develop the self-assessment tool and to formulate improvements for the selected policy instrument. And for us, it's also interesting, of course, to learn from the other markets. Of course, we have quite a lot of experience, but it's always interesting for us to see how other regions work, where their challenges are, where their strengths are, and we can learn from them as well. So I think this aspect of mutual learning is really very important for us as well, even if we do not have to address a specific policy instrument.
No, we're very, very happy to have you on board. And I think the podcast episode that we had makes clear why. With your, like I said, your long year experience that you have had in working as a living lab with the different methodologies and different challenges that living lab has from the beginning. But I think thank you so much. I don't know, Daniel, if you have any questions.
Thank you so much to provide us with so many useful, fruitful information. And I guess that was a really very thoughtful and interesting discussion and chat we had on the living labs. And I'm pretty optimistic that all the audience will think the same. Thank you so much for all the input and your time, of course.
Okay.
Glad to hear it. So once again,
thank you.
See you soon.
Talk to you later. Bye.
Bye-bye.
Bye-bye.
Bye.
Thank you to Vicky and Ingrid for joining us for today's episode. And thank you, our listeners, for joining us as well. Be sure to check our show notes and see where you can find more information about LiCalab, Interreg Europe, and ACSELL. ACSELLcast is created by myself, Sandra Evans, as well as Daniel Boer, Christine Hopkins, and Markus Streimer.